Hi class, and welcome to chapter 1, which will take us through kind of an introduction to human anatomy and an orientation to anatomy. How I will do these lecture videos is that they will be a little bit condensed because I'm going to try to pick out the most important information that I want you guys to focus on. So if you see a PowerPoint with 150 slides, I'm probably not going to cover all of them. I'll point out what you need to know. I might even pass over some things and say, take a look at this. But me talking to you in this recorded lecture environment, I want to focus on the most important things that I want you to know. So an overview of anatomy, and again, this PowerPoint, you're responsible for all the information, and I'll try to pick out the important things. Anatomy is the study of the structure of the human body. So that's what we're focusing on in this course. I also teach physiology, which is when we learn about how the structures come together and help your body function and do all the processes. But anatomy, you guys are going to be doing a lot of memorizing structures and where they're located, and you're going to learn a lot of new names. Think of anatomy like learning a new language. We have different disciplines of anatomy. We have gross anatomy, which is more a macroscopic view, things you can see with your own eyes, where we look at things regionally, like the shoulder, the face, the ankle, or systemic anatomy, which looks at surface structures as a system, like the circulatory system would include your heart and blood vessels. Surface anatomy looks at anatomy on the surface, and microscopic anatomy really zooms in on the anatomical structures, and we call that histology. We have other branches of anatomy that we won't really get into. Developmental anatomy, embryology have to do with anatomy in the womb. Pathological anatomy is pathology, looks at disease associated with structures. Radiographic anatomy looks at anatomy underneath different types of radiographs or other visual ways of looking at it. And then functional morphology looks at how your anatomy can change generation to generation. We have a structural of the body, and we start at the basic level of the chemical level. These are atoms. Your atoms will join to form molecules, and molecules will come together to form cells at the cellular level. The cellular level consists of cells and all of their functional subunits. Cells will come together to form tissues, which is a group of a specific type of cell coming together to perform a function. The organ level is the discrete structure made up of more than one tissue. The organ system level will be all the organs working together for the common purpose, like your circulatory system, your respiratory system. And then the organismal level is the result of all the simpler levels working together in unison. We are organisms. Your pet dog is an organism. We'll be focusing on humans in this class, but the organism level is taking all 11 body systems and how they work together. And this is a great slide to pause the recording at and read through to see pictures and descriptions of each one of these organizational levels. The integumentary system will form the external body covering. It protects deeper tissues from injury. It synthesizes vitamin D, and it's the site of cutaneous receptors like pain and pressure, and all of your sweat and oil glands. Skeletal system protects and supports your body organs, provides a framework for muscles. Your red and white blood cells are formed within your bones, and your skeletal system also stores minerals like calcium and potassium. The muscular system allows for manipulation of movement or in the environment. It helps you move, helps move the muscles of your face for facial expression, helps you maintain posture for sitting up and standing up straight, and also producing heat. So when your body gets cold, your muscles shiver to try to create more heat. The nervous system is the fast-acting control system. It responds to internal and external changes. It activates your muscles and your glands. The endocrine system, one of my favorite systems because it's a teeny tiny system that shoots out a bunch of hormones that help to regulate growth, reproduction, and nutrient use. The cardiovascular system has blood vessels in your heart. Your heart pumps blood through the blood vessels, and the blood vessels are important for transporting and carrying oxygen and carbon dioxide and carrying nutrients and wastes. The lymphatic system is also known as your kind of immune system. It helps to pick up fluid leaked from blood vessels, returns fluid to the blood, disposes of debris in the lymphatic system. It houses all of your white blood cells called lymphocytes. It mounts the attack against foreign substances in the body. And then your respiratory system keeps your blood supplied with oxygen that you breathe in. It removes the carbon dioxide that is a waste product from your cells that we exhale. And the gas exchange that occurs happens in little tiny air sacs in your lungs called alveoli. The digestive system breaks down food into anything that can be absorbed within your digestive tract. Indigestible foodstuffs get eliminated as feces. And then your urinary system will filter all of your blood. It will eliminate nitrogenous wastes from your blood. It also helps to regulate your water, electrolyte, and acid-base balance of the blood. Then we get to the reproductive systems. The overall function is to produce an offspring. The testes produce sperm and male sex hormones like testosterone. You have male ducts and glands that aid in the delivery of sperm to the female reproductive tract, where we get to ovaries, which produce eggs and female sex hormones like estrogen and progesterone. Your female structures serve as sites for fertilization and development of the fetus. Your mammary glands produce milk. A system of measurement in anatomy is the metric system, which is scientifically used around the world, not so much in the United States, but scientifically, this is how we measure things. And we measure things with units of measurement, which are listed here: the meter, the centimeter, the micrometer, which all have to do with length. Liter and milliliter have to do with measuring fluid levels, and kilogram and gram measure weight. Anatomical terminology, we'll get to a lot of new words, we're going to learn a new language, is based on ancient Greek or Latin, and it provides a standard nomenclature worldwide. So even in other languages, for example, my daughter broke her radius, and we are in Ecuador right now, and in Spanish, radius is radio. So things have a kind of a Greek or Latin base, which helps worldwide for anatomy to keep its names. So here are the regional and directional terms of anatomical position, which is a common visual reference point. In anatomical position, the person stands erect with their feet together and eyes forward. Their palms face anteriorly with the thumbs pointed away from the body. And we get to some regional terms of the body this way. The axial region is the head, neck, and trunk. And the appendicular region are all of your appendages, your legs and arms. Then we use standard directional terms, which are used by professionals, whether that's a physical therapist, a chiropractor, a doctor, to describe the location of one body part in relation to another. And this is extremely important if you're going into surgery, going through therapy, to have kind of a basic standard way of describing anatomical structures to each other. These are regional terms of the body. So again, this is a good spot to pause the lecture video and to look at what these regional terms are called. Eventually, you'll see that these regional terms will directly give names to the structures beneath them, like the frontal region. The area below the frontal region has your frontal bone, which is your forehead, and also the frontalis muscle. So different regions will give names to the structures below them. And these are common body region names of posterior and anterior. And here's the posterior side. So then we get to some directional terms that are used to explain the position and the precise location of the body structure in relation to another body structure. And the terms are paired with their opposite ones. So superior and inferior has to do with things towards the head or towards the feet. Anterior and posterior, also ventral and dorsal, anterior towards the front, posterior towards the back of the body. Medial and lateral, a medial structure is located closer to the midline, which goes down the center of your body, or lateral is further away from your midline. And then superficial and deep have to do with structures superficial, closer to the surface of the skin, and then deep would be within the skin surface or within your body. So these are examples. So describing structures: inferior, superior, medial, and lateral. The heart is medial to the lungs because the heart is towards the midline, and the lungs are lateral to the heart because the lungs are further away from the midline. Proximal and distal are also regional terms. Proximal is closer to the origin of attachment, so closer to the trunk, and distal is further away from the point of attachment. So the knee is distal to the thigh because the knee is further away from your body trunk than your thigh is. Ipsilateral is on the same side, and contralateral is describing something on the opposite side of the body. Here's a look again at posterior, superficial, and deep, some more directional terms, looking at a CT, a CAT scan, and a transverse section. So the sternum, which is your breastbone, that's anterior to your heart. Your vertebrae is posterior to your heart. Superficial, the heart is deep to the sternum because it's further inside the body. So the heart is deep to the your rib cage, which covers it, but the sternum is superficial to the heart because it's closer to the surface. Then we get to body planes and sections. Sagittal planes, these are planes of the body that divide the body into different halves. And this helps radiograph technicians see what they're looking at inside the body. Sagittal planes extend vertically, so they separate the body into right and left parts. So if we do a sagittal plane through the skull and open it up, that's what we would see. We would see a sagittal view of structures inside. The median mid-sagittal plane runs directly down the midline, and parasagittal planes run vertically, but a little bit offset from the midline. The frontal coronal plane lies vertically and divides the body into an anterior and a posterior part, and then a transverse plane runs horizontally and divides the body into a superior and an inferior part. So these are a look at planes of the body with corresponding MRI scans and why it's important for these planes and understanding the cuts through them, how we get different views and images of the organs inside your body. So taking an MRI is really helpful for looking at, for diagnostic purposes, what's going on inside of the body. And if you take a median plane cut, these are the structures you would see. A frontal plane cut, these are the structures you would see. And a transverse plane cut, these are how the structures would be viewed, for an example, in an MRI. The human body then, really simply put, is like a tube within another tube. There's bilateral symmetry, meaning the muscles that you have in your right arm, you most likely will have in your left arm. There's a dorsal hollow nerve cord, which means that's the spinal cord connecting to the brain. The nodal cord and vertebrae surround that vertebral column, segmentation, and pharyngeal pouches. So we're going to talk through kind of this human body plan. The basic human body plan indicated by structures and is shared among all vertebrates. You have an inner tube, which is the digestive tube. The brain and spinal cord is the dorsal hollow nerve tube. The segmented outer tube control is all the muscle segments. And then the nodal cord is also shown here. So this is a basic human body plan, which is shared among all vertebrates. Here's a look at a transverse section, or actually this is a look at a human embryo at 5 weeks post-conception. And you can see how everything is starting to form: the lung buds, the digestive tubes, the heart, the muscle segments, the nodal cord and the spinal cord, which will eventually make up the nervous system, and the brain. Then here's a look at the basic human body plan in the adult human. And you could see going from the human embryo to the human, how these structures start to form. The inner tube, the digestive tract in yellow, the muscle segments, muscles between the ribs with the heart in between them, the spinal cord, the vertebrae. So you can see how we get from an embryo with these body plans to the adult human. The dorsal body cavity are the body cavities in the back. So the cavities that hold all the organs in the posterior side. We have the ventral body cavities. So the cranial cavity houses your brain, and the vertebral cavity houses your spinal cord. And then ventral body cavities, you have a thoracic cavity divided into 3 parts, 2 lateral parts, each containing a lung, surrounded by the pleural cavity. And the mediastinum is in the center, that contains the heart, surrounded by the pericardial cavity. The abdominal pelvic cavity is divided into 2 parts, the abdominal cavity and the pelvic cavity, and they each contain different organs. The abdominal cavity has your liver, stomach, kidneys. Pelvic cavity is more of your bladder, your reproductive organs, and your rectum. So this is a look at your body cavities, where they're located, and you can imagine the organs that would go in them. And another look, the thoracic cavity contains your heart and lungs, the pericardial cavity with your heart, pleural cavity with the lungs, and the superior mediastinum contains some of the blood vessels exiting the heart. Here's the abdominal cavity and the pelvic cavity. You can see the cranial and vertebral cavity going down the dorsal or posterior side of the body. Then we have serous cavities, which are like a slit-like space lined by serous membrane that's made up of a parietal serosa, which is the outer wall of the cavity, and the visceral serosa, which covers the visceral organs. The serous fluid is produced by both layers of the serous membranes to help reduce friction and to provide some more protection for the organs below them. So here we have the ribs, the parietal pleura, lining the outer cavity where the ribs lie, the pleural cavity with serous fluid, and then the visceral pleura, which is the lining of the ribs themselves. The diaphragm is the muscle most important for breathing that's located below the ribs. Here's the look at the heart with the parietal pericardium covering the outer pericardial cavity, the pericardial cavity with serous fluid, and the visceral pericardium lining the actual organ of the heart. And this is a transverse section of the heart, or excuse me, the liver and the stomach, and showing where these cavity linings lie. The serous cavities and their associated membranes, what I just described, is like putting your fist into a balloon. If your fist is the organ, the outer balloon wall is that parietal serosa. The inner balloon wall is the visceral serosa, which directly touches the organs. And the air between them is the cavity, the serous cavity between the two, that's most often filled with fluid. The abdominal quadrants then divide the abdomen into 4 quadrants, the right and left, upper and lower quadrants. And you can see these here. These quadrants are important to identify pain of what might be going on below the quadrants, and also basic names for surgery-related procedures. So you can see what organs and where they lie in all 4 quadrants. So this would be another good slide to pause and make sure you know where these organs lie in all 4 quadrants. Microscopy is then examining small structures through a microscope. Light microscopy illuminates the tissue with a beam of light on a lower magnification scale, and electron microscopy uses beams of electrons to produce a higher magnification. So if we were in lab, the microscopes we use in lab usually give us pictures like this light micrograph. The transmission electron micrograph is even more highly zoomed in, and the scanning electron micrograph gives us about 2,500 times zoomed in. So you can see the difference. We're looking at cilia here, which line the outer cell layer of the cilia in your epithelium. In order to prepare a human tissue for microscopy, we fix it, preserve it, section it, and then stain it. Usually an acidic stain is a negatively charged dye, basic stain is positively charged dye. Don't worry about this. A scanning electron microscopy gives us a 3-dimensional picture, and an artifact is a minor distortion of a preserved tissue, which is not exactly like a living tissue. An X-ray then is an electromagnetic wave of a very short length, and X-rays are best for visualizing bones and abnormal dense structures. As shown here, we can get a chest X-ray and also a lower GI X-ray showing barium contrast. So this person was injected with an element called barium to allow us to see a little more in depth the color, the shape, and the way the large intestine is laid out. Computed axial tomography is a CT or CAT scan. This takes successive X-rays around a person's full circumference, and then the computer translates the recorded information into a detailed picture of the body section. And maybe some of you have had a CAT scan before, and this is the image that would come out. So it would look like an X-ray, a little bit shorter, but it can take this whole circumference of the body. Angiography is a more advanced X-ray technique. This uses a contrast to highlight vessel structures. Digital subtraction angiography uses images taken before and after a contrast medium injection, where the computer subtracts before from after to identify a blockage of an artery to the heart wall and brain. So these are a look at the major coronary arteries of the heart. And you can see here this person was injected with a medium to try to brighten or light up the arteries around the heart. Here's an artery supplying the heart, and you can see here how the artery is very narrow. So there's most likely a blockage in this artery, and this person is in danger of a heart attack. A PET scan forms images by detecting radioactive isotopes injected into the body. So that's a positron emission tomography. A sonography is an ultrasound where the body is probed with a pulse of high frequency sound waves that echo off the body's tissues. And this imaging technique is used to determine the age of a developing fetus. So here's a look at a PET scan before treatment where the tumors are visible in the right breast and the liver. And the PET scan after treatment, you can see how the tumors have been gone, probably thanks to chemotherapy. So that's a good PET scan result. Here's a look at a sonography and ultrasound showing a developing fetus. They're able to measure the head, the circumference, the length from rump to head to be able to more verify how old this fetus is and how far along the mother is. An MRI is a magnetic resonance imaging, which produces a high contrast image of soft tissues. And this distinguishes body tissues based on their relative water content. So here's a look at an MRI, a volume rendering of an MRI of the head, of a normal knee, and then an injured knee with a torn meniscus and versus a meniscus intact. So very helpful for diagnosing problems. That's the end of chapter 1. Thanks for listening, guys, and I hope you're doing well, and we will see you for chapter 2.